He's my hero.
I always wanted a little boy. At 14 weeks, we had our first sonogram. They were like, well, you need to go see a perinatologist because I think that something may be wrong. Reed had fluid around all of his organs, his kidneys, his heart, his liver. The doctor that we were seeing, he came out and he said one of two things are happening. Either he has got some major chromosomal things going on, or you have an infection in utero and his organs are shutting down and you're going to lose him. He told us that we probably wouldn't have him. We can either do an amnio or do you want to continue with the pregnancy? And I was like, is that a question that you ask people? Is that
for real?
Procedure?
Yeah.
Do you ask people that?
We have a very blended family. We adopted 4 children that were in foster care. Cassidy we got when she was 5.
She was coming home from school and she bruises all up her arms, her legs, but her face got almost white, just ghost white. And I remember saying, yeah, we need to get her into the doctor tomorrow morning because something's going on and I don't know what it is. They ended up diagnosing Cassidy with aplastic anemia. Your body stops producing red blood cells, white blood cells, and platelets. And you need the white blood to fight off the infection. You need the platelets to be able to clot blood, and the red blood for oxygen to all your organs. And if you don't have any of those, then you pretty much can die.
Because of the damage to his kidney, he had to have some routine tests done all the time. We were in radiology and they started doing a sonogram of Reed, and I knew something was wrong immediately. And the radiologist came out and she said, we're gonna have to admit you. There's a mass on your son's kidney and it's the size of a grapefruit.
We were terrified.
What they do basically is for about 8 days leading up to the transplant, you're given chemotherapy and total body radiation. And then they're basically wiping your immune system out and it's making it down to nothing. She had no way to fight any infection, anything, and any little cold could have probably killed her.
And then you're wondering if you're doing the right thing because the medications that she's getting is causing other problems. I mean, her blood pressure was so high she had a seizure. There was just so many complications that come along with those medications.
My favorite sport is football, but I sadly can't play. So I'm a manager for the high school here and my junior high. I can't play any contact sports because if I get hit in the kidneys, it could cause them to stop working or something, and I don't want to take that risk. It makes me feel sad that I can't do other things that normal kids can do, but at the same time, there's different things than just football.
He wants to play football so bad. So bad. That's the hard thing, because he wants to play sports so bad, and he can't. He's gonna run track this year, which I'm so excited because he gets to at least do something like that.
Bodhi is he's very interesting. He comes off as a little bit shy, but we always joke that he releases pheromones that makes everyone who meets him, they love him. He's a very determined person too. If there's something he sets his mind to, even with his recovery after he went into remission, and the doctor told him, well, it'll take about a year for you to physically get back to where you were as an athlete. And he was like, nope, that'll be maybe 4 months and I will be back to, where I was, if not further along.
And so Wody was diagnosed with nodular lymphocyte predominant Hodgkin's lymphoma. But once that diagnosis is presented, there's an opportunity for therapy. And the nice thing about nodular lymphocyte predominant Hodgkin's lymphoma is that it is extremely treatable, especially in adolescence.
I think in the middle of 7th grade, I had surgery on the lymph node because it was as big as a golf ball. In 2018 of my 8th grade year, we found out that I had cancer. I feel relieved that I don't have to deal with that anymore. Also feel grateful that I don't have to some people are chemo, radiation for 3 years, 4 years, maybe even the rest of their lives. And I'm just grateful that I don't have to deal with that. It was on my day that I was officially in remission. It was my bell ringing ceremony, and it was kind of cool because the day I was officially done with chemo and I could do those fun things that I've always wanted to do. He's coming up with like tons of like little goodie bags for all the like little kids and stuff that were in chemo. I went to a little tour, golf tour. It was really awesome. It's pretty cool how he supports that. That's what makes me want to be a nurse, like giving back, because what he did actually really helpful. Got my mind off everything.
I remember meeting T-Bone the first time at Whataburger. He asked me when I was going to be in the hospital, what I'm going to do, you know, while I'm there, what would I like to do, and I said that I'd really, really love to learn to play the guitar. So I always wanted to because I like to sing also. And he said, we're going to get you a guitar.
When he was first admitted to the hospital, I remember thinking, oh, what are we gonna do? Like, I have nothing. I am not prepared for this. Someone came into our room and they gave us a backpack, and it was full of shampoo and conditioner,
Laundry
and
detergent.
all of the necessities that you would need for an overnight stay in the hospital. We didn't have any food. I didn't have any money because we just found out our kid had cancer. So, you know, we're paying deductibles, and we literally used everything in that bag that week we were in the hospital. I used the gift card to buy food in the cafeteria. I showered at the hospital because I didn't leave his side. I rewashed my clothes, and it was awesome. It took a huge load off of our shoulders. A few months later, T-Bone was actually at the hospital, and Reed was in the playroom, and they got to meet.
Well, he actually was. Reed would sit on
he would sit on the IV poles.
He'd
And
cross
he would
his
ride
legs,
him.
and we'd just push him on the IV pole, and that's actually when we met T-Bone. So it was kind of neat.
He came and hung out with Reed in the playroom, and like they had a connection right away. They became buddies.
And he also let me go in a fishing tournament about that, and I won, and I caught the biggest redfish. Then he told me about this thing, like I could shave my head and I'd get money from it. And so all the money that I get from doing that, I donate to the hospitals. And also for 2 years now, I've been getting money on my birthday, and all the toys I get are donated to the hospitals. I help them because they've helped me through a lot of stuff, and so like I'm trying to give back, even though it'll be hard to give everything back to them. But like I just like it's like a thank you to them. The team at T-Dog at Cancer has done a lot for me and a lot for other people. I'm extremely happy to be a part of that team.
What T-Dog at Cancer does for these children, and especially mine, is brings that hope back to them. The fun, the getting to be a kid again and not just all medical, and making sure they have that to get through each day, because they go through a lot.
There aren't enough words to say. They're awesome.
Can't find the words to say
It
that.
really is. I mean, every time I see them,
I'm grateful,
You know,
very grateful.
I love them to death, especially when you need the help and you need it and you need it now. You call him and it's like
Done.
that. It's
Not even a question.
amazing.
But like T-Dog at Cancer is our lifeline.
Yeah.
I mean,
If you have the privilege to meet T-Bone and his team, I'm positive you won't be disappointed, because it feels like you enter this bubble that just fills you with happiness and hope, and feels like it's gonna be good, and you can move forward without looking back.